Thank you for joining us on Health Matters. A warm welcome to the program. I am Yomi Otaigbe. According to the World Health Organization, in 2022, there were an estimated 2.3 million women diagnosed with breast cancer globally, the most common cancer in women in 157 countries out of 185. Roughly half of this figure occur in women with no specific risk factors other than just their sex and age. We are all connected to this topic in one way or another, even if we don't realize it yet. Today on the program, we are not here to just talk about statistics. We are here to talk about our lives, our loved ones, and the power of knowledge. We'll talk about how we can transform awareness into action and fear into empowerment. Do stay with us on Health Matters. My guest on the show is Dr. Muhammad Habibu, a lecturer at the College of Medicine, University of Lagos. He's also a consultant radiation and clinical oncologist and the chief clinical coordinator, NSIA Luth Cancer Center. In the field of oncology, Dr. Habibu has special interest in prostate, breast, colorectal, and head and neck cancers. He's a fellow of the West African College of Surgeons and American Society of Clinical Oncologists, among others. Thank you, Dr. Habibu, for finding time to be with us on the program.
Thank you.
So we've been told that breast cancer occurs when the breast tissue grows abnormally and then forms tumor. But I'm sure one of the very pertinent questions that our viewers would have is, what are the risk factors for breast cancer?
Well, the most important risk factor is the gender, being a female, because 99% of breast cancer patients are women. And the older the lady is, the higher the risk. That's from puberty. Breast cancer usually does not occur before the 4th decade of life. Also, usually,
but sometimes.
Okay,
it does happen.
Sometimes it does, and we are increasingly seeing it happen more. And among blacks, it occurs earlier in age than the Caucasian. And there are other factors that can also predispose. For example, sedentary lifestyle, taking of fatty diet,
sedentary lifestyle meaning not exercising.
Not exercise, yes. So exercise is good to reduce the risk, and also fatty diet, use of contraceptives in a way. Not breastfeeding, and we have many other factors that predispose. In some families, it could be familiar. That means there are genes that could be responsible for increase in breast cancer in those families. For example, the BRCA gene. So in such family, you see breast cancer in maybe mother, auntie, sisters, and predominantly in the female. Even in the male, you can see breast cancer. It could be genetically linked.
Now, let me go back to the percentage you gave earlier, 99%
yes.
of women, you say? So that means there's
99% of patients that have breast cancer.
We're talking about the fact that patients, 99% of patients that have breast cancer are women.
Yes.
That means there's a 1% that could be men.
Yes, we have male breast cancer, and we are regularly treating them. We treat them exactly the same way we treat the female.
Wow, why would it happen in a male? I'm just curious.
Yeah, the male also have breast, only that is rudimentary. So it can, once you have an organ, every organ in the body, there can be cancer, so long as the organ has blood supply. That's it's a living organ. Yeah.
And then you mentioned contraceptives. I thought we promote family planning and
we promote family.
Which one of them could be a trigger?
Now, hormonal, some type of hormonal contraceptive can predispose, and the time at first childbirth also is a factor. So those women that have their first child before the age of 25 are less likely to have breast cancer than those who have it at later age. And also breastfeeding protects. So nulliparous women are more predisposed. Women who are elderly primigravida, that give birth later in life, their first child, and those who do not breastfeed are also predisposed to breast cancer.
So it's good as we promote breastfeeding, we know that it also has the benefits of protecting the woman.
Yes.
Let's talk about diagnosis. So at what point will it be said that this woman or this man has breast cancer?
Okay. Now, it will detect breast cancer early and improve the chance of survival. It's good to do screening, because at the point that you start seeing the symptoms, it might be late. It might be already late. Screening involves self-breast examination, where the woman examine her own breast using the right hand on the left breast and the armpit, and the left on the right breast and the armpit, usually around 10th day of menses. Then also, such a woman can also visit a doctor maybe once a year or once in 6 months, or a trained staff, a matron, a clinician, to do what we call clinical breast examination. You know, a trained person may discover lumps and abnormality better than an untrained. Then we also have imaging tests. That's what you can use to view the breast, like ultrasound scan and the breast mammogram. Ultrasound scan is usually used for younger women, while mammogram is used for older patients. This can pick up any lump or any abnormality that you cannot pick up with your hand. So these are screening methods. So, but if we pick up an abnormality, then we now have to do further investigation. If it's a lump, what we normally would do is to do what we call biopsy. It could be using a needle, fine needle aspiration by an FNAC, where you just use, take some samples of the lump and take it to the lab. So it is from the lab we do the histology that you will know whether it's cancerous or not. So we look at
not every lump that is cancerous.
In fact, most lumps are not cancerous, especially in younger women. It's only at the extreme of age that you now have more, percentage of lump that are cancerous.
So
but
if any woman finds a lump, you shouldn't be afraid. At the first,
you shouldn't be afraid. You should
just go and check.
Yes, go for further investigation. Let them take a biopsy, put it under the lab, and look at the cells of the lump to see if they are normal cells or abnormal cells.
So aside from lump, that would be perhaps a possible sign. What are the other signs that we can look out for?
Yeah, there are many other signs. For example, you look at the shape of the breast. The breasts are almost symmetric, identical. Maybe one just a little bigger than the other. But if there is a marked disparity between the breasts, then you should go for
from what it used to be, particularly.
Yeah, from what it used to be. Then you can also see at times what looks like rashes. What look like rashes, what look like inflammation, and at times the nipple, if you express it, you may see discharge. This discharge could be bloody discharge. And then apart from that, you may even see lump in the armpit. You may not see it in the breast, but you may see it in the armpit, and it may be from the breast. But the armpit is easier to see the lump. So you can even be a wound, a chronic wound, what we call chronic ulcer. There could be a chronic ulcer, it could present like that, and when you investigate further, you find out that it's actually a cancer.
So we're more concerned about prevention where possible, because sometimes some of these things happen that even medicine would not have explanation for it. So what are those, aside from people who have a family history of it, what are those things that women can do to protect themselves from all of those risks that can predispose them to breast cancer?
Yes. Now, exercise. Like I said earlier, sedentary lifestyle increase the risk. So we need to have regular exercise. Secondly, reduce alcohol intake as much as possible, because alcohol has been found to increase, breast cancer. Junk food. We have to limit junk food. That's high residue diet. We take more of food that are not fatty, because fatty food will predispose to, breast cancer. Then following childbirth, there must be breastfeeding. Breastfeed, for at least like a year, if it is possible, not less than 6 months of comprehensive breastfeeding. That will also help to improve, the breast health, not to have breast cancer. Then if there are breast lumps that are not, if you've had breast lump that is not cancer in the past, then you need to be more, careful. You need to do more of screening. Because
how often should that screening be?
It now depends on what we see, because the presence of lump that is not cancer in the breast also increase the chance of having cancer. And if somebody has been treated for breast cancer in one breast, it increases the chance of breast cancer in the other too. So if we do the screening and nothing is seen, you can wait for another 6 months. That's, I'm talking of the imaging, but monthly you can do the breast self-examination. But the clinical and the imaging could be 6 monthly if it is
depending on the woman's age. Or
depending on what you
age,
see,
what's its puberty? Or
no, depending on what you see. If you've done a scan and it's completely free, then you may even wait for a year. But if there are lesions that you are not sure of, then it could be 3 months. You understand? So based on what you see when you examine, it will determine when next you do it.
You had mentioned earlier that breast cancer is commoner from the 4th decade of the woman's life. Yes. But you have also in clinical practice,
yes,
you've seen women younger. What
yes,
would you say is responsible for that?
One, race. In the black race, we tend to have cancer at an earlier age. The peak age is lower than that of Caucasian. Then genetic predisposition also make breast cancer come earlier, but it's not all the time we are able to ascertain the real reason why it came early. But if there are other genetic conditions, it might also predispose to early breast cancer.
Okay. All right. We'll just take a quick break now. When we come back, Dr. Abibu will still be here to answer your questions or take your comments. To stay with us on Health Matters.
Stay connected to the world with Channels TV Podcast and get all the trending stories. Simply log on to channelstv.com, click on podcast, select the program of your choice, and listen. Our podcast is available on Apple, Google, and Spotify. Tap the expertise you trust. Touch the stories that touch you. Anytime, anywhere.
Thank you for staying with us. You can join us in this conversation via phone on 0808-054-2233 or Yomi_Taigbe. That's on X. So before we went on break, we were talking about prevention. And you mentioned screening, avoid junk food, exercising, and all of that. Now, let's talk about for those who already have it. They've done the screening, they found the lump that is cancerous. What is the first step?
We have to do staging. Staging means looking at how far the disease has spread, because the stage determines the mode of treatment. And also we have to look at what type of breast cancer it is. So apart from histology, there is what we call immunohistochemistry. Immunohistochemistry tells us what the breast cancer is sensitive to. We have those that are sensitive to hormone, we have those that are sensitive to targeted therapy, which are other agents, and we have those that are not sensitive to any of them, the one we call triple negative. And unfortunately, in this part of the world, triple negative is more common, especially for younger patients, and we have to do only with chemotherapy or do further immunohistochemistry to see whether it's sensitive to another type of agent, that's checking the BRCA gene. So after doing that, if it is an very early disease, maybe the lump is so small, less than 2 cm, you might decide to just take off, do a surgery just to remove that aspect, so long as it's not an aggressive type. But if it is the aggressive type, we are now talking about what we call grade, which discuss the level of virulence of the disease. Diseases that are very virulent, that are high grade, we often require systemic therapy. That is either chemotherapy, hormonal therapy, or targeted therapy, depending on what we see on immunohistochemistry. So usually, generally, treatment of breast cancer is multimodal. We can do surgery, we can do chemotherapy, we can do hormonal therapy, we can do radiotherapy, and then targeted therapy. Usually a combination of this, depending on the type of and the stage of the cancer.
Okay, I've seen women who have survived cancer, breast cancer, and it gladdens my heart. But when we talk about breast cancer, there's the fear that someone would not, make it. Where is that fear coming from? And is it something that is, that can be real? I know.
Well, there are a lot of myths around breast cancer. First, most of our patients present late. They present in the stage 3 and stage 4, making curative treatment very difficult. Secondly, many people believe that chemotherapy does kill. A belief that many people are afraid of chemotherapy. Again, some believe that breast cancer is a spiritual problem. So if it is a spiritual problem, ordinarily they expect it to require spiritual treatments. So most of these conditions make them present late. So when they present late, it becomes difficult to cure. However, those who present early, usually they can have curative treatment.
So the important message here is that presentation, one, knowing first, what is different with a woman's breast, and then, taking action where it is necessary. So, what would you, so we've talked about the misconception that it could be something that is, people believe it's spiritual, but other people believe that they just want to use herbs and they are fine with it. What would you say about that?
Because they believe that chemotherapy kills, which herbs have not been put into research. In medicine, you have to do research. It's not, we don't just believe, you have to do a proper research. And this has been done, by the standard organization, and we have international way of doing the treatment, which is chemotherapy. So until the herb has been tested, we cannot say that the herb is, effective. And many of our patients have used herbs, and the herb failed to control the disease before they present. So there is no documented, fact that we have herb that cure cancer.
Okay, now, so when that result comes and a woman has breast cancer, and we have issues of stigma, that's on one side. But what would you say is the first thing that one can say to someone who's got that result?
Okay, now
in terms of support.
In terms of support, it depends on at what level the patient presents. So if it's an early case, the first thing you should let the patient know is that it's curable. If you have assessed and you say it's curable, then you give an example of those who have survived it. There are many examples, including wives of governors, many that, and then we have support group that we also link the patient to. So they talk to survivors in the support group who encourage them, because once they speak to survivor, those who survive, they are encouraged to also do the treatment. That's what we normally would do.
So the support group, they offer emotional support. Because yes. Cancer can be very
traumatic,
yes, emotionally draining, exactly. And financially draining.
Exactly.
Let's talk about the accessibility to treatments too, yes. In Nigeria.
Yes. Well, most patients still pay out of pocket, making treatment very laborious. However, federal government instituted NICRAT to oversee, programs, policies on screening, research, and treatment. And I'm also aware that there is now a cancer health fund, and there is also CAP program by the federal government. However, these programs, they are still relatively new, and they are just in one center per geopolitical zones, and access has not yet, it's not yet robust. But hoping that in future this fund will be able to cater for the finance that goes with cancer treatment. And I also hope that private organizations should use this as a source of corporate social responsibility, maybe to set up health insurance, robust health insurance that can cater for cancer patients. But at the moment, it costs an arm and a leg to treat cancer. Most of the patients, those who have houses, they sell their house, they sell their property, they sell their cars just to get treatment for cancer. And
that's heartbreaking.
It's heartbreaking because the treatment is usually prolonged. It's not like most other conditions.
How long can it be, depending on what stage?
For early stage, treatment can be up to 6 months or more. But if a patient presents at late stage, usually treatment is just prolonged.
Prolonged for
because you are not able to cure it. So the patient has to continue treatment for as long as the patient is around.
Okay. Now, we're going to wind down now. As you leave here, doctor, what is that most important thing or message that you have for our viewers, both male, female, everyone is watching?
Screening for male, more of prostate cancer, but for female, screening both for breast cancer and cervical cancer is very important, so that if it comes and is detected early, the cure is there. The exercise has the beauty of preventing not just cancer, not just breast cancer, most cancers, hypertension and diabetes. Exercise is very good for that. Then also the knowledge of cancer, so that you can have a good diet and good environmental control. For example, you take less of fatty diet, less of processed food, and also you stay away from chemicals as much as possible. And the radiation if possible.
Thank you so much, Dr. Abibu, for your time on the show today. Dr. Muhammad Abibu is a consultant radiation and clinical oncologist. Thank you for your time.
Welcome.
We have a couple of minutes to go, but not without serving you what's making the rounds in the health world on our news segment.
The public awareness walk in Owerri, the Imo State capital, to commemorate the 2025 World Stroke Day. Neurologists and other medical professionals take their message to the streets, holding a sensitization rally to debunk the long-held myth that stroke is a spiritual attack or the result of unforeseen forces. They stress that stroke is a medical emergency that can be prevented, detected early, and treated when people seek prompt care, emphasizing the need for regular health checks, healthy lifestyle habits, and early response to warning signs.
We have a mnemonic. We say, be fast, be fast. Where B, it's talking about loss of balance. When somebody suddenly experiences loss of balance. E refers to loss of vision, and a sudden loss of vision, either one part of the vision or both part of the vision. F represents facial weakness. F, facial weakness. A represents arm or leg weakness on one side or both sides. These things occur almost instantaneously in a normal person. S represents speech problems, and then T is time to act, because we know that time is brain. The earlier you get to the right place, the earlier you get evaluated, the earlier you get the right treatment and leading to recovery.
The theme this year says every minute counts. Every minute of stroke counts. You can't delay. There are things you need to do. You can revert the disability and even convert or revert from death. because stroke is known as the leading cause of disability and death in our country or in sub-Sahara.
Healthcare as a value chain, building efficiency from policy to patient, formed the crux of discussions at the scientific conference of the 2025 Physicians Week organized by the Lagos State branch of the Nigerian Medical Association. Officials and members of the association and guests at the event believe that to bridge the gap between healthcare policies and patient care, there is need for deliberate action in the planning and management of Nigeria's healthcare delivery system.
We need to empower health facilities through decentralization and giving authority to local managers and involving members of the communities in the management of facilities providing services to them. That, in my opinion, will help us to ensure efficiency.
In terms of the provider, which are the doctor and the other health worker, how do you maintain them to reduce the japa, improve their remuneration, give them a better welfare package like car loan, like housing loan, training and retraining. They also be operating in a conducive environment, research, and all those things have been there. They will improve the health setup.
The Federal Neuropsychiatric Hospital Lagos is advocating for the use of artificial intelligence in mental health research. At the hospital's 2025 research conference, the guest speaker and medical director of the institution, while recognizing the positive and negative aspects of the use of artificial intelligence, maintained that AI has been advantageous when it comes to health assessment, diagnosis, treatment, and recovery.
Currently, we are now having virtual therapists through artificial intelligence, meaning that some of our psychological intervention can be delivered through artificial intelligence. And if this is the case, that we are now using it in the mental health treatment, then there is need for us to also take note of it in the area of research.
AI has come to stay. AI is revolutionizing various industries, and AI, mental health center is not an exception. And we're going to see a lot of benefit by the time we start adopting it in research in Nigeria.
As we bring health matters to a close today, remember that this awareness is to spur you or your loved one into action, replacing fears with empowerment. Thank you for your time on the program. Stay with us on Channels Television. I am Yomi Otaigbe.